There's a congenital disease called DiGeorge syndrome, and they have sometimes a congenital heart component. Can you just talk about that just a little bit?
Yes, DiGeorge syndrome is a spectrum. In other words, it's a whole group of illnesses. But the common thread in DiGeorge syndrome is that the patients have an immunologic deficiency. That means that their own body's defense system doesn't work in a normal way when it's called upon to fight off bacteria or viruses or other types of illnesses. So that immunologic defense system is, in very small children, in some ways regulated to an organ inside the body called the thymus. And the thymus is an organ which is located very close to the heart. In fact, it sits right on top of the heart. And some of the cells inside the body that generate the body's defense system come from that organ of the body. Now, DiGeorge syndrome, in DiGeorge syndrome, patients will either have a small thymus or a very absent thymus gland. When they have this, some of them, not all of them, but some of them will have a lack of a proper defense to infection. Now, that absence of the thymus gland is associated with a spectrum of congenital heart disease. That spectrum of congenital heart disease has a fancy medical name called conotruncal abnormalities.
Ooh, these names.
But what basically that means is that some patients, particularly patients that have a narrowing of the aorta or aortic coarctation, or in some cases a complete interruption of the aorta, which also occurs in some children, it's the extreme form of coarctation of the aorta, will have associated with it DiGeorge syndrome.
Are there any other major cardiac conditions associated with DiGeorge?
Any abnormality that involves the way the aorta and the lung artery separate embryologically can be associated with DiGeorge syndrome. So patients with something called truncus arteriosus, where they only have one large artery arising from the heart, have a common association with DiGeorge syndrome. Truncus is not very common congenital heart disease, and so we don't see that many patients with it, but in the small number of patients that we see with truncus arteriosus, DiGeorge syndrome is commonly associated, but it can also be associated with coarctation, interrupted aortic arch, tetralogy of Fallot. So there's a wide spectrum of congenital heart disease that it can be associated with.